When and why prods come in a girl's life. Prods is not a recognized term in this context, but it seems you might be referring to periods. Periods, also known as menstruation, typically start in a girl's life during adolescence, usually between the ages of 9 and 16. The age of onset can vary widely from person to person. The onset of menstruation is primarily driven by hormonal changes in the body. Specifically, the increase in estrogen triggers the development of the female reproductive system, including the release of eggs from the ovaries and the shedding of the uterine lining. Menstruation. The main purpose of menstruation is to prepare the body for potential pregnancy. Menstruation continues throughout a woman's reproductive years, typically until the age of 45 to 55 when menopause occurs. During this time, a woman's menstrual cycle can vary in length and symptoms, including cramps and mood swings, can occur. It's essential to remember that menstruation is a natural and normal part of a girl's and woman's life. However, the experience and symptoms can vary, and some individuals may seek medical advice or use various products like pads, tampons, or menstrual cups to manage their periods effectively. If you have specific questions or concerns about menstruation, it's a good idea to consult with a healthcare provider who can provide guidance and support. Reducing heavy menstrual bleeding, also known as menorrhagia, can be achieved through various methods. Here are some approaches to consider. Consult a healthcare professional. If you're experiencing heavy bleeding, it's important to consult a healthcare provider. They can help identify the underlying cause and recommend appropriate treatments. Medications. Your doctor may prescribe medications such as nonsteroidal anti-inflammatory drugs, NSAIDs, or hormonal birth control, like birth control pills or an IUD with hormones to regulate your menstrual flow and reduce heavy bleeding. Tranexamic acid. This medication can help reduce heavy bleeding by promoting blood clotting. It's typically taken during your period. Iron supplements. Heavy bleeding can lead to anemia. Your doctor may recommend iron supplements to prevent or treat anemia. Lifestyle changes. Maintaining a healthy lifestyle can help manage heavy bleeding. Eating a balanced diet, exercising regularly, and managing stress can contribute to overall well-being and may help reduce the severity of your symptoms. Herbal remedies. Some herbs like ginger and turmeric are believed to have anti-inflammatory properties and may help reduce heavy bleeding. However, it's essential to consult with a healthcare provider before using herbal remedies. Surgery. In severe cases, surgery may be necessary. Procedures like endometrial ablation or hysterectomy can be considered to treat heavy bleeding when other methods are ineffective. Remember, the right approach to reducing heavy menstrual bleeding depends on the underlying cause and your individual health needs. Always consult a healthcare professional for a proper diagnosis and personalized treatment plan. Never be careless about health. Get your illness treated in time. If you like my videos, then forward health issues, like, share, subscribe, tell your family and friends.